Social anxiety. Anxiety affects nearly 20 million people in the US, and studies show that millennials and Gen Z are reporting more cases of anxiety than ever before. And one of the most common forms of anxiety? You guessed it, social anxiety. We're going to talk about the difference between social anxiety and shyness, and I'll give you 3 tips to help manage social anxiety. Stick around. This is Real Life Psych. Hey everyone, my name's Alexa Simos, and I'm a licensed therapist. Welcome to my channel, Real Life Psych, where we break down common, everyday mental burdens that have a significant influence on our mental and physical health, whether we realize it or not. As always, new episodes come out every Sunday for what we call Not So Scary Sundays. So, all the chores you've been ignoring all week, well, they can wait another 7 minutes or so. It's time to reflect. If the pandemic shutdowns have benefited anyone outside of Jeff Bezos and Elon Musk, it might be people with social anxiety. Because in the day and age where we're constantly reminded of just how cool our peers are when they post all of their fun pictures, it seems like they're always making new friends. There are many of us who would just rather stay at home and are thrilled we no longer have to find excuses for why we just couldn't make it. Meanwhile, Netflix is asking us for the 4th time if we're still watching. So, does this just mean that we're shy? Or is there a component of social anxiety disorder? This is so important to understand because some people have dismissed their social anxiety disorder thinking they were simply shy, because shyness is being anxious or reserved around people. On the other hand, social anxiety disorder can be described as a persistent, intense fear or anxiety about a specific social situation. This causes us to avoid these situations because we believe we may be judged, embarrassed, or humiliated. Or if we do endure these situations, it's with intense fear or anxiety. Some of that overlaps with shyness, but one of the key differences between shyness and social anxiety disorder is that for people with social anxiety disorder, the level of avoidance and the intensity of fear and the impairment of functioning that it causes in someone's life is severe. When it starts to hinder our ability to go to work or school or just leave the house in general, there's even more reason to be concerned. A 2019 Blue Cross Blue Shield report found that millennials and Gen Z are being diagnosed with social anxiety disorder at an all-time high. What's additionally concerning is that although the symptoms of social anxiety disorder are often unbearable and hard to handle, studies have shown that over a third of people with social anxiety don't seek treatment until noticing symptoms for 10 years. This is unfortunate because the longer it goes untreated, the higher the risk of other mental and physical health effects. Now, what can we do about it? Start by seeing a medical doctor who can evaluate and hopefully refer you to a mental health specialist. Now, here are 3 techniques that a therapist can use to help manage your symptoms. 1. Systemic graduated exposure. Slowly exposing yourself to the anxiety-provoking environment. This allows us to learn how our bodies respond to anxiety-provoking situations. And over time, we can realize that some of the fears of the negative outcomes are more unlikely than we think. 2nd, cognitive restructuring. This is where we really think about our perceived negative outcomes, essentially asking ourselves, what's the worst that could happen? This helps us address the irrational fears that continue to interfere with our functioning. 3rd, social skills training, which is role-playing designed to help people learn appropriate behaviors and decrease anxiety in social situations. Treatment not only involves therapy, but may include anxiety medication as well. Finally, guys, I urge you, if you think you may have social anxiety disorder, please do not just dismiss it as shyness. Waiting 10 years to get evaluated could be harmful. At the same time, if you are working on your anxiety or any other mental illness, I want you to be patient with yourself. It takes time and it's not easy, but you are capable. And that's it for today, guys. Thanks for tuning in to another episode of Real Life Psych. If you like this type of content, make sure to hit the like button and subscribe to our channel. Remember, Sundays don't have to be so scary when we can get together and reflect. Self-improvement begins with self-awareness. See you guys next week.